All right, once again, the miracle weight loss drug Ozempic, or semaglutide, is back in the news again. Let's go check and see what's going on this time. There's some new problems we're finding out about. So hey guys, this is Dr. Shawn Baker. I'd like to share some information with you about some of these weight loss drugs and why they may not be a good choice for weight loss for you or some of your family members. Now, semaglutide, also sold as Ozempic, Wegovy, or Revero, is a diabetic drug approved in 2017 for diabetes, is now being used for many people kind of off-label for weight loss. A 2021 article in Reviews in Endocrine and Metabolic Disorders explained that semaglutide increases insulin secretion while inhibiting the opposite hormone, glucagon. They kind of compete with each other. Now, this means your body is forced to store glucose and the liver is blocked from breaking it down and making glucose available to you. Now, while Ozempic does reduce A1C and glucose levels somewhat, does it actually put diabetes into remission like we've seen with some other lifestyle strategies? Well, guess what? An average A1C of 7 is still very much into the diabetic range, so it's not really doing much in that regard. Now, what risks are people getting into by taking this drug? The FDA is currently reviewing the risks of people that are actually taking their own life. Now, this is also being investigated in Europe. According to the Mayo Clinic, using this medicine with any of the following medicines is usually not recommended. The journal Drug Design, Development and Therapy published a 2022 article about patient selection for this drug. Now, the article lists some of the specific contraindications to taking this drug. News medias were very quick to pick up upon this risk. Now, Medline Plus, an online journal for physicians, published another warning about semaglutide and thyroid cancer. Now, you know, people are just trying to find a shortcut by just taking a pill, but when it comes to weight loss, really, there's no safe shortcuts. You might think, but hey, those problems don't really actually happen in real life, do they? Well, there's a YouTuber who shared her Ozempic experience. She had gotten her lymphocytic colitis to go into remission, and we know how painful it could be, but Ozempic had that beat.
Now, I have suffered from a condition called lymphocytic colitis for like 12 years, I would say. Maybe longer, I don't even know at this point. So I am no stranger to that, but my colitis had actually been in remission since like late 2020-ish, around the time where I healed my gallbladder. The colitis also went into remission around that time. So to be in remission with colitis for almost 3 years, only to be hit with a literal poop storm the day after starting this drug, I was pretty confident that I knew it was the drug causing it. And may I just say, if any of you have colitis or Crohn's or anything like that, you know the absolute agony, meaning pain, that it physically causes in your intestines. Well, buyer beware, because that pain has nothing on Ozempic.
What happens if you stop taking it? Well, let's look at Remy Bader, another famous YouTuber.
I was like, I bet the second I go off, I'm gonna get starving again. I did, and my binging got so much worse. So then I kind of blamed Ozempic. I gained double the weight back after.
Now, a randomized control trial looking at this was published in Diabetes, Obesity, and Metabolism. They concluded that 1 year after withdrawal of once weekly subcutaneous semaglutide of 2.4 milligrams and lifestyle interventions, participants regain the majority of their weight back. What's another option if people want to lose weight? Well, let me think real hard about that one. The carnivore diet has proven to cause excellent weight loss. A 2004 study from experimental and clinical cardiology looked at the long-term effects of a ketogenic diet on obese patients. Now, they showed that in the long term, obese patients lost their weight and improved their lab work. So what would you rather do if you had to do it for the rest of your life to maintain a normal weight? When you consider the risk of thyroid cancer, taking your life, or gaining all the weight back, I think the choice should be clear. We don't even have to discuss nutritional value diets either. You could eat a garbage diet and control your weight with this drug for the rest of your life, but how well are you providing nutrition to your body? Or would you rather just eat the most nutritious food known to man? Oh, and one more thing. What does this drug cost anyway? Which one would you choose? That buys a lot of ribeyes for that price. Okay, if you guys know anybody that's thinking about taking this drug or just needs to lose weight, share this video with them. And please let me know what you think. What would you guys do if it was you? Now, thanks for watching. We will see you guys on the next video.